a hidden organ, a daily habit, and the questions men whisper after 45. Tonight, we ventured deep into the walnut-sized gland that silently controls your comfort, your confidence, and at times, your very sense of self. The prostate, overlooked for decades, suddenly becomes center stage after 45. It begins to swell, stiffen, and sometimes speak through pain, discomfort, or fear. And for men who masturbate every single day, the prostate is quietly adapting, changing, sometimes in ways no one expects. Are these changes helpful or harmful? In this video, we'll explore what happens inside your body when this daily ritual becomes routine. And by the end, you'll not only understand the strange biological shifts, but you'll also walk away with 7 science-backed ways to protect this powerful but vulnerable part of your body. Please kindly click the subscribe button and share this video with every man you care about. Let's start at the root. The prostate is a small gland, roughly the size of a walnut, located just below the bladder. It wraps around the urethra tube that carries urine and semen out of the body. B-roll, animated overlay of prostate gland enlarging, then calming. Though tiny, the prostate is responsible for a big job. It produces a thick, alkaline fluid that makes up about 30% of semen. This fluid nourishes sperm, protects them, and helps propel them forward. B-roll, animated overlay of prostate gland, enlarging, then calming. But as men age, the prostate doesn't stay quiet. Around the age of 45, testosterone begins to decline about 1% each year. Yet, paradoxically, another hormone called dihydrotestosterone, or DHT, accumulates inside the prostate. B-roll, animated overlay of prostate gland, enlarging, then calming. This DHT sends a silent but firm command: grow. Over time, the gland enlarges. That growth isn't always cancerous, but it can press on the urethra, slowing urination, reducing sexual function, and even impacting sleep. Understanding the role of masturbation in this hormonal ecosystem begins here. Imagine wringing out a sponge every single day. Now imagine leaving that same sponge soggy for a week. The difference? Fluid dynamics, pressure, resilience. When a man ejaculates, his prostate contracts strongly. These contractions aren't just about climax. They help flush out the ducts of the prostate, clearing cellular debris, inflammatory molecules, and even early accumulations of calcium. B-roll, animated overlay of prostate gland enlarging, then calming. In this way, daily ejaculation can serve as a kind of mechanical cleaning cycle. Some researchers believe it reduces the risk of stagnation and chronic inflammation. But there's a flip side. That daily contraction can also cause microtraumatiny, near-invisible tears in muscle and epithelial lining. The body responds by activating enzymes like COX-2, which are associated with inflammation. Over time, this can create a feedback loop of tension, repair, and remodeling. Dr. Luka Rakitic, a urologist specializing in pelvic floor disorders, puts it this way: for some men, daily release is like physical therapy. For others, it becomes a source of hidden tension they don't even realize they're carrying. Masturbation isn't just physical, it's hormonal. In the minutes before climax, testosterone briefly spikes. It's nature's way of ramping up arousal, drive, and focus. But what goes up must come down. After climax, a different hormone takes over: prolactin. Prolactin is responsible for the refractory period, that phase where a man feels momentarily uninterested in more stimulation. But when prolactin spikes every single day, it can begin to interfere with the body's dopamine balance. Low dopamine, over time, can cause fatigue, fog, emotional flatness. Then there's oxytocin, the connection hormone. It's released during climax too, but in solo play, it fades quickly. Without the presence of a partner, oxytocin's mood-elevating effect is shorter-lived. When daily masturbation becomes the norm, your hormones adapt to that rhythm. For some, this is energizing. For others, it leaves a shadow fatigue, low mood, or sexual disinterest that feels out of place. Visual cue. color-coded hormone fluctuation chart. Here's where the word strange earns its weight. Under a microscope, the prostate of a man who ejaculates daily doesn't look the same as one who abstains for long stretches. The internal ducts, the channels that carry fluid, stretch wider. Their epithelial walls thicken slightly, a response to the constant passage of fluid and pressure. B-roll, animated overlay of prostate gland enlarging, then calming. In some cases, small nodules form collections of collagen that accumulate as the muscle fibers heal microtrauma. Over years, these can make the prostate feel stiffer, even if it's not significantly larger. B-roll, animated overlay of prostate gland enlarging, then calming. Another odd change, microcalcifications. These are tiny stones grains of calcium and phosphate that collect inside ducts. Daily flushing keeps them small, like gravel instead of rocks, but it also breaks larger ones into pieces, increasing their number. It's not cancer, it's not dangerous, but it can contribute to discomfort, especially when urinating or sitting for long periods. Doctors often miss these signs because the symptoms can mimic others: prostatitis, overactive bladder, even mild erectile dysfunction. But inside, the architecture is changing. The muscles surrounding the prostate are often forgotten until they hurt. Meet the pelvic floor, a web of muscles that support the bladder, bowel, and sexual organs. When you climax, these muscles contract rapidly and forcefully. It's a coordinated squeeze, pushing fluid through narrow ducts with precision. B-roll, animated overlay of prostate gland, enlarging, then calming. Now, imagine doing that every day, without recovery, without stretching, without awareness. Over time, these muscles can become hypertonic, meaning they stay partially contracted, even at rest. This creates a quiet but persistent tension in the pelvis, often felt as aching, burning, or pressure near the perineum. It's a condition commonly misdiagnosed as prostatitis, yet the real culprit is muscular, not microbial. Men who masturbate daily are more prone to these patterns, especially if they spend long hours sitting, clenching, or experiencing stress. Relief often begins with something simple but overlooked: breathing. Reverse Kegel exercises and diaphragmatic breathing retrain the pelvic floor to relax. It's not glamorous, but for many men, it's the single most important step in resolving persistent discomfort. The body isn't just reacting hormonally or microscopically, it's reacting mechanically. And like any muscle system, the pelvic floor needs balance between tension and release. For many men, the first sign that something's wrong is a slow burning discomfort, not sharp, not sudden, just a feeling that things aren't right. This often leads to confusion between two culprits: inflammation and infection. They may sound similar, but their root cause and treatments are very different. Let's break it down. When the prostate is inflamed, the tissue swells. This can happen from pressure, overuse, hormone imbalances, or irritation. It's your body's immune system sending troops where there's no actual enemy, like sounding the alarm when no burglar has entered the house. B-roll, animated overlay of prostate gland, enlarging, then calming. On the other hand, infection involves real invaders. Bacteria, most commonly E. coli or Enterococcus, can travel up the urethra and infect the prostate. This is rarer than most think, especially for men without urinary obstruction or catheter use. And it's even rarer in men whose only regular sexual outlet is solo. B-roll, animated overlay of prostate gland, enlarging, then calming. The confusing part? The symptoms often overlap: pain between the legs, frequent urination, burning during urination, cloudy semen. That's why many men get misdiagnosed and misprescribed rounds of antibiotics that don't help. Instead of killing bacteria, what many of these men need is to calm inflammation. How? Start with hydration. Water-thin secretions, reducing the friction and flushing out irritants. Next, zinc, quercetin, omega-3s. These aren't miracle cures, but they gently shift your body away from inflammation over time. And finally, recognize your triggers. Stress, caffeine, alcohol, all of these can ignite a low-grade fire inside the prostate. B-roll, animated overlay of prostate gland, enlarging, then calming. What's happening in your body might not be dangerous, but it is trying to tell you something. If you're a man over 45, you've likely heard the acronym that makes many flinch, PSA, prostate-specific antigen, a protein produced by both healthy and unhealthy prostate tissue. The higher your number, the more your doctor may worry about cancer. B-roll, animated overlay of prostate gland, enlarging, then calming. But here's what many men don't realize. PSA can fluctuate for completely benign reasons. One of the most common, ejaculation. A 2004 study of over 1,000 men showed that within 24 hours of ejaculation, PSA levels could rise by as much as 0.4 nmol. For some, that's the difference between normal and concerning. But by 48 hours, levels return to baseline. That means if you're getting tested, especially if your doctor is looking for subtle changes daily, masturbation can throw off your results. The solution is simple. Abstain from ejaculation for 48 hours before a PSA test. It's not about shame or fear. It's about clarity. Because that number isn't just a number. It drives decisions, biopsies, anxiety, and for men who masturbate daily, that small detail, just 48 hours, could prevent a month of unnecessary worry. When it comes to the prostate, no word carries more weight than cancer. It lingers in the back of every man's mind, especially after 45. B-roll, animated overlay of prostate gland, enlarging, then calming. So, what does science actually say about masturbation and prostate cancer? B-roll, animated overlay of prostate gland, enlarging, then calming. In 2016, researchers at Harvard conducted one of the most comprehensive studies to date. They followed over 31,000 men for nearly 2 decades. Their discovery? Men who ejaculated 21 or more times per month had a 22% lower risk of developing prostate cancer compared to those who ejaculated less than 7 times a month. B-roll, animated overlay of prostate gland, enlarging, then calming. That's a powerful statistic, but it comes with a caveat. These high-frequency men were also more likely to be in better health overall, leaner, more active, and more engaged with regular health screenings. That makes it difficult to isolate cause from correlation. Still, there is no study known that links daily solo ejaculation to an increased risk of prostate cancer. If anything, moderate to frequent release may help by keeping ducts clear and inflammatory responses in check. B-roll, animated overlay of prostate gland enlarging, then calming. However, ejaculation alone is not a shield. It's one variable in a much larger equation. Diet, genetics, toxin exposure, hormone levels, these all matter too. And cancer is rarely caused by one factor. So while masturbation may contribute to a lower risk, it's not a guarantee, nor is it something to fear. The real takeaway? If you're healthy, it's likely safe. If you're not, look at the full picture, not just your habits, but your biology, your history, and your lifestyle. Science speaks in numbers, but real life? It speaks in voices. Let's meet 3 men, each navigating their own journey with daily masturbation and prostate health. B-roll, animated overlay of prostate gland enlarging, then calming. Victor, 55, IT consultant. Victor had been masturbating daily since college. For decades, it was a way to relax, unwind, and manage stress. But in his early 50s, he began to feel a strange heaviness in his pelvic region. His doctor found no infection, no cancer, just mild inflammation. It wasn't until Victor added stretching, yoga, and pelvic floor relaxation exercises to his routine that things shifted. Today, he still maintains his habit, but with balance. Samuel, 63, retired firefighter. Samuel was diagnosed with chronic prostatitis, burning during urination, discomfort after ejaculation, even some blood in his semen. At first, he panicked. But after consulting a urologist, He reduced his masturbation frequency to 3 times a week and added anti-inflammatory supplements. Within a month, the flare-ups calmed. Leon, 48, recently divorced. Leon turned to daily masturbation to cope with loneliness after divorce. It helped his mood at first, but when his PSA levels spiked to 4.8, his doctor suggested a biopsy. On a hunch, Leon abstained for 4 days and retested. This time, his PSA dropped to 3.1. No biopsy needed. These stories show one thing clearly. Daily masturbation isn't right or wrong. It's personal, and how your body responds may be different than anyone else's. The key is listening. By now, you've seen that daily masturbation has ripple effects from hormone shifts to microscopic changes in the prostate itself. B-roll, animated overlay of prostate gland enlarging, then calming. So what can you actually do to stay balanced, healthy, and pain-free without giving up a habit that might bring you stress relief or emotional comfort? Here are 7 safeguards. Each one is grounded in science. Each one can make a difference. 1. Observe a 48-hour buffer before PSA tests. If you're scheduled for a PSA blood test, abstain from ejaculation for at least 48 hours. This simple pause can prevent false spikes in PSA readings and avoid unnecessary follow-ups or even invasive biopsies. 2. Hydrate deeply and consistently. Your prostate thrives when your body is well hydrated. Aim for at least 2 liters of water daily. It helps thin out the seminal fluid, supports urinary flow, and reduces the risk of inflammation. B-roll, animated overlay of prostate gland, enlarging, then calming. 3. Prioritize magnesium. This underappreciated mineral is crucial for muscle relaxation, including the smooth muscle tissue in the prostate. Eat more spinach, pumpkin seeds, and almonds. Or talk to your doctor about magnesium glycinate supplements. B-roll, animated overlay of prostate gland enlarging, then calming. 4. Cool down with reverse Kegels. After ejaculation, take 2 to 3 minutes to relax the pelvic floor with controlled diaphragmatic breathing. A reverse Kegel helps counteract the tension and restores muscle balance. 5. Eat antioxidant-rich foods. Your prostate is highly sensitive to oxidative stress. Combat it with foods rich in lycopene, found in cooked tomatoes, EGCG from green tea, and flavonoids in dark berries. These compounds fight inflammation at the cellular level. B-roll, animated overlay of prostate gland enlarging, then calming. 6. Protect your sleep and melatonin. Melatonin isn't just for sleep. It's also involved in immune function and hormone regulation. Avoid screens at night and sleep in a dark room. Good sleep equals good prostate health. B-roll, animated overlay of prostate gland enlarging, then calming. 7. Commit to annual exams. Don't rely on symptoms alone. Some prostate changes are silent. An annual digital rectal exam and a PSA test, when done thoughtfully, can catch problems early. B-roll, animated overlay of prostate gland enlarging, then calming. These aren't just habits, they're a form of self-respect. Because when you take care of the organ that no one talks about, you send a powerful message to yourself. I am worth protecting. There's a fine line between routine and ritual, a fine line between comfort and compulsion. For many men, masturbation begins as a harmless form of release, a way to relax, a way to fall asleep, a way to deal with stress, loneliness, or even boredom. But what happens when it becomes automatic? Every day, no variation, no thought, no joy, just habit. That's when the brain begins to shift. You see, each time you climax, your brain releases a hit of dopamine, the reward chemical, the motivator, the pleasure center. But if that circuit is triggered too often without variation, it begins to dull. The same stimulus yields less reward. The brain starts chasing novelty, fantasy, escalation. That's how some men find themselves locked into a loop, masturbating not for pleasure, but from compulsion. And afterward, guilt, emptiness, shame. There's even a name for it: post-ejaculatory dysphoria, a condition where men feel anxious, depressed, or hollow immediately after climax. It's not common, but it's real. And it's often a sign that something deeper is going on. So what can you do if you suspect you've crossed that line? Try the 7-day reset. 1 week without masturbation. Not forever, just long enough to allow your dopamine receptors to recalibrate. During that time, track how you feel, your energy, your focus, your cravings. You might notice something unexpected: sharper erections, a stronger sense of control, even deeper emotional clarity. The goal isn't abstinence, it's awareness. Because when your pleasure is a conscious choice and not a compulsion, you own it. It doesn't own you. There's another layer to this conversation, one that often goes unspoken: the difference between masturbating alone and sharing sexual intimacy with a partner. Now, physiologically, both can result in ejaculation, but emotionally, hormonally, biologically, they're very different. When a man climaxes with a partner, the brain releases a deeper, more sustained wave of oxytocin, the hormone of connection, bonding, and emotional safety. Oxytocin doesn't just feel good. It reduces inflammation, buffers cortisol, and strengthens cardiovascular health. In a 2019 study, partnered intimacy was shown to reduce markers of prostate inflammation more effectively than solo climax. The reason? Researchers believe it's the emotional regulation that comes from touch, presence, and reciprocity. B-roll: animated overlay of prostate gland enlarging, then calming. But here's the catch. Partnered sex isn't always available. Some men are single. Some are in relationships with mismatched libidos. Others feel emotionally disconnected. That's why masturbation is not only common, it's often necessary. So what's the ideal balance? Think of it like cross-training. Just as your body benefits from different types of movement cardio, strength, flexibility, your prostate and hormonal systems benefit from varied sexual expression. B-roll: animated overlay of prostate gland enlarging, then calming. Solo release can be a tool for self-care. Partnered intimacy can be a tool for healing. Both matter. Both serve a purpose. And when done conscious rather than compulsively, both can be part of a healthy, fulfilling sexual life well into your 60s, 70s, and beyond. It's not about choosing one over the other. It's about knowing the value of each and letting your body, your needs, and your relationships guide the way. The world is changing fast, and for men concerned about prostate health, that's not a bad thing. B-roll: animated overlay of prostate gland enlarging, then calming. Science and medicine are advancing in ways our fathers couldn't have imagined. And the future of prostate care isn't just about surgery and medication, it's about precision, personalization, and prevention. B-roll: animated overlay of prostate gland enlarging, then calming. Take HIFU high-intensity focused ultrasound. This technology uses sound waves to target and destroy abnormal prostate tissue without a single incision. It's non-invasive, and it's being used right now to treat early-stage prostate cancer and shrink benign nodules. B-roll: animated overlay of prostate gland enlarging, then calming. Then there are wearable pelvic sensors. Imagine a smart device you can clip to your waistband that monitors your pelvic floor tension throughout the day. When it senses chronic clenching often, the root of unexplained discomfort gently vibrates, reminding you to relax. Early trials show promising results for men with chronic prostatitis symptoms. But perhaps the most intriguing development? Microbiome mapping. New research is uncovering links between gut bacteria, inflammation, and prostate function. What lives in your gut may influence your prostate health more than previously believed. Some studies now explore stool and semen correlations, hinting at a future where a simple sample might reveal your inflammation, risk, and even tailor probiotic therapies to prevent disease. B-roll: animated overlay of prostate gland enlarging, then calming. The takeaway is this: you are not stuck with the past. You are not chained to your genetics. And you don't have to wait until something goes wrong. With emerging technology, we're entering an era of proactive prostate healed. Your prostate has been with you since boyhood. B-roll, animated overlay of prostate gland enlarging, then calming. It grew with you through puberty. Activated when desire first sparked. It remained quiet, steady, uncelebrated as you built your career, raised your family, carried the burdens of manhood. Now, in your 40s, 50s, 60s, ask for attention, not because it's broken, but because it's part of you. Daily habits, daily choices, they shape this organ, like a river carving stone. Not all changes are bad, not all routines are harmful, but all of them leave a trace. You've just spent an hour learning what most men never hear in a lifetime. And that knowledge, simple, practical, rooted in truth, is yours now. No one can take it from you. This isn't about fear. It's about respect. For your body, for your rhythm, for your health, because what we honor, we protect. And what we protect, we keep strong. Age, one where knowledge lets and fear fades. The future is coming, and it's coming for your healing. Men over 45 are taught to fear decline. We're told our best years are behind us. We're told to hide our questions, to pretend we don't feel the changes, to suffer quietly through slow streams, lower desire, and uncertain blood test results. But I say this, you don't need to shrink as your prostate grows. You don't need to lose touch with your strength, your rhythm, your pleasure. B-roll, animated overlay of prostate gland enlarging, then calming. You just need to understand it. So here's your move. Choose one of the 7 safeguards we talked about. Just one. Start it tomorrow, keep it for a week. See how your body responds when it knows you're paying attention. Because the most dangerous myth isn't that your prostate will fail, it's that you have no control. B-roll, animated overlay of prostate gland enlarging, then calming. That's the lie. And now, you know better. The host turns slightly toward the camera. A faint smile. The tone softens. Listen to your body. Honor your pleasure. Guard your future. I'm Dr. Luka Rakitic. Subscribe. Share this with a brother, a father, a friend, and stay strong where it counts. This video is for educational purposes only, not a substitute for medical advice.